Hello, my name is Stephen Allen from the Department of Electrical and Computer Engineering at Brigham Young University. My talk discusses using an iron-based coupling medium for MR-guided focused ultrasound. During transcranial MR-guided focused ultrasound surgeries, thermal buildup in the scalp and skull can induce adverse effects such as pain and skull lesioning. Additionally, the risk of thermal buildup limits the total acoustic power a surgeon may deposit, and thereby precludes from treatment subjects with unfavorable skull composition. To reduce these risks, chilled water-based acoustic coupling media fill the space between the transducer applicator and the patient. However, during incination, this water bath is not circulated, even though circulation can enhance the convective heat transfer coefficient at the scalp of the patient. This is because when circulating, the water-based media introduce adverse errors and artifacts into guidance MRI scans. In this study, we test whether a continuously circulating iron-based coupling medium will improve MR thermometry precision relative to water. We report the synthesis and other characterizations of this IBCM at locations linked to by the QR codes presented on this slide and the next slide. Briefly, the IBCM consists of approximately 3 millimolar concentrations of electrosterically suspended small diameter iron oxide nanoparticles coated with a polymethacrylic acid corona. These particles reduce the T2 relaxation time of water to about 5 to 6 milliseconds, while preserving the favorable acoustic and thermal properties of water. Our hypothesis is that an iron-based coupling medium will improve thermometry during continuous circulation, and this hypothesis was tested by placing a gel phantom at the focus of an Exablate Neuro 650 kHz hemispherical transducer array. The space between the phantom and the transducer was filled with either circulating water or a circulating iron-based coupling medium. Sagittal slice GRE images were acquired of the phantom using a clinical thermometry sequence, and acquisition parameters are described on this slide. The thermometry sequence is virtually identical to those used during clinical procedures. The scan was repeated 13 times in order to compute through-time temperature precision maps, and the experiment was then repeated while shrinking the prescribed fields of view of the scan to 18 centimeters. The resolution of the smaller field of view scans were adapted to keep the total image acquisition time identical between the two fields of view. On to the results. This figure maps pixel-wise temperature precision that we observed in the phantom for both water and the iron-based coupling medium. The average and standard deviation values for these pixels within the green bounding boxes are also reported. As expected, continuous water circulation introduces time-varying motion artifacts that create a spatially varying increases in temperature uncertainty. Some regions experience uncertainties as high as 3 degrees Celsius. When the circulating water is replaced with a circulating iron-based coupling medium, these motion artifacts disappear and the temperature uncertainty only varies with the natural B1 transmit field inhomogeneity that's inherent to this transducer design. Finally, when we shrink the field of view from 28 centimeters to 18 centimeters, aliasing from a circulating water coupling medium significantly worsened the estimate of thermometry precision. However, the circulating iron-based coupling medium, because it exerts very little signal, does not contribute aliasing and motion artifacts that degrade the thermometry precision estimate. As in the previous slide, the average and standard deviation of the estimated precision values within the green bounding box are also presented. And please note that the precision values presented here have been scaled by the ratio of voxel sizes between the two field of view experiments. Doing so compensates for the natural decrease in signal-to-noise ratio and thermometry precision that comes from reducing voxel sizes between the two experiments. So in summation, we found that the use of a continuously circulating iron-based coupling medium during a clinical thermometry sequence removed motion and aliasing artifacts. As a result, thermometry precision estimates improved relative to those found when circulating water. and these positive results persisted even when the scan field of view was reduced to 18 centimeters. These results support our premise that a circulating iron-based coupling medium may better prevent skin and skull thermal injury during MR-guided focused ultrasound surgery than water, without causing adverse effects on guidance magnetic resonance imaging. Finally, I want to thank my collaborators at UVA and Virginia Tech and Brigham Young University, as well as my funding sources, including the Focused Ultrasound Foundation. Thank you.